Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Them on the playing field, parents are always concerned about safety. Dr. Krisht joins us today from the Arkansas Neuroscience Institute at St. Vincent, and today we're going to talk about head injuries and what parents need to know to ensure that their children get the right medical care that they need. So Dr. Krisht, thank you for joining us.
Thank you for having me.
First, let's just talk about the problem. What is the extent of head injuries in the United States right now?
Yeah, well, I think the best thing is to start with numbers. There is no less than 450,000 to 500,000 head injuries that occur in the age group 14 and below. So that's a large number per year. What's interesting, if you look at the statistics, the top of the list is biking, and most than likely it has to do with the fact that there's a lot of bikers who are not using their helmets, unfortunately, and then goes down to football, and then to other sports such as baseball and so on. And down on the list, you can see up to trampoline injuries, skateboards, scooters. They're all kind of different causes of these head injuries.
Yes.
Now, fortunately, that most of these injuries are mild or moderate. Most of the severe head injuries are usually due to high-speed MVAs, motor vehicle accidents. So the problem is big, especially if you have repeated injuries, and that can be a cause of long-term problems.
I think we have another graphic to show addressing how to decide when an injury is mild or severe. So tell us what we're seeing here.
Well, these are different areas of the brain. This is a cut through the brain and shows where a bruise in the brain can occur. You can see it on the top right. This is like a blood clot that's between the bone and the brain, and the other one on the left side, it's on another layer. They may look the same, but it's different layers under the skull. And then in the back, you see a big blood clot inside the brain. All these types of bruises or clots can occur from any type of injury. Now, what's important to know is you can have a major head bump, and you can feel like you're not right for a day or two, and you may have something like that and you didn't know about it.
Okay, how do parents then know we need to go see a doctor?
Yeah, well, there are certain signs and symptoms that are important to not neglect. For example, if somebody fell and after the fall they forget that what happened, we call it amnesia, to the time when the last few things that occurred before the head injury, that's an important sign, because that means the brain erased all what happened, and that's a severe injury enough. Any loss of consciousness, if somebody was out of it, then that's important to seek medical attention. Anytime there is a significant symptoms associated with it, like vomiting or a headache that comes afterward, as well as some kind of jerky movements that may suggest seizures. Those are kind of ominous signs that you need to be taken to seek medical attention or to an emergency right away.
What about children or infants who maybe can't tell us how they're feeling?
Yeah,
how would you judge that?
And this is going to be the biggest role for mom or whoever is taking care of them, because if they get fussy, they're not feeding well, they start excessively burping instead of little amount of food, a lot of it, they don't do well with it, they're getting sleepy, then those are signs which usually moms are going to be able to sense that something is wrong. But after a bump, you don't want to underestimate it. I think it's best to have an opinion from an expert than just to sit on it and assume, well, it looks okay.
Exercise caution and go ahead to a doctor. Let's talk about precaution and maybe how to avoid these injuries in the first place.
Yeah, well, it's interesting. I was giving a little class to my daughter grade and about head bumps, and most kids know what should be done. The problem is when they don't do it. When I ask them how you should protect your head, and everybody knows they have to have the helmet, they have to avoid going to high places, and to make sure that they listen to the grown-ups, to what mom says, the teacher, and so on.
Right.
I think the only way we can avoid this is by reinforcing the information to the kids, and it will be good to also give them life examples of what can go wrong. And you'll be surprised how smart they are, and they can respond well. But I think the most important thing is to follow the instructions of any sport. Don't underestimate it. You don't want to be in front of a baseball without a helmet.
Right.
And you don't want to be in the field playing football without a helmet, or biking without a helmet. And these are, at that age group, these are the most essential protection mechanisms.
Enforce you do not get on that bike without the helmet on.
True.
That's the point.
Yes.
All right, I think we'll have to wrap it right there. We thank you for coming in. I think eye-opening on the types of sports, you know, all that are involved in head injuries. So remember, of course, the Arkansas Neuroscience Institute at St. Vincent. There's the information right there on your screen. You can call them if you think you need to set up an appointment, or you need more information on head injuries. I know that they can get it to you. Thank you, Dr. Krisht.
Thank you.
Thank you for coming. Everybody have a safe weekend out there.